Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everyone. You're listening to Policy and Rights here on Depictions Media Radio, and I am Michael. So we have pre-recorded parts of a Pan-American Health Organization, or PAHO, webinar on vaccines and the importance of vaccines. First, we're going to hear from Dr. Barbosa. He is the Assistant Director for PAHO, and he's going to say some really important things about misinformation and things that will mislead people into not getting vaccinated, and thus it will lead to continued infection and spread of infection of the virus, which would continue the pandemic further and further, bringing more economic disparity, and for the most part, and the most important part, is actually costing people's lives. That we are talking about a virus that it may have similar flu symptoms, but the thing I want to remind people is that it has a almost 20% fatality rate, which influenza does not really have. So we do need to follow all of the COVID safety protocols, the social distancing, the hand washing, the sneezing into our sleeves, all those sort of things. We need to actually make sure that we stick to these protocols until the pandemic is actually over, which brings us to the importance of the vaccine as a tool to help curb the spread of the virus. So let's listen to what Dr. Barbosa had to say during the webinar.
Good afternoon, and sorry because I received a urgent call that I need to take, but I could see part of this very interesting presentation from Quatemoc. I would like to welcome all the participants in this webinar for journalists and communicators, where we will be providing an update on the COVID-19 vaccines and discussing how to promote responsible and evidence-based news coverage related to the vaccine. As you know, the world hopes soon to have a COVID-19 vaccine or vaccines as one of the most effective measures to control the pandemic and to reduce the public health, economic, and social impact on our populations. However, once the vaccine is available, ready and available for distribution, it will be rolled out amid a series of important challenges. Among them, first, ensuring equitable, timely, and sufficient access to the vaccine, addressing technical and logistic aspects, such as the development and production of vaccines, some of them utilizing very innovative technologies, defining the priority groups to receive the first vaccine doses, and determining the appropriate number of doses for adequate protection. Additionally, vaccine rollout and its subsequent uptake is target populations will be carried out within the context of the infodemic and misinformation surrounding the COVID-19 vaccine. Even though the COVID-19 vaccine has not received the regulatory approval for its use in the population, there has already been significant media coverage, conversations on social media, and speculation on this topic. Widely circulating Myths and misinformation increase the risk that people will choose not to seek out the COVID-19 vaccine as recommended when it becomes available, and may also contribute to individuals losing faith in routine immunization programs, thereby putting the population at risk of contracting vaccine-preventable diseases like measles, pertussis, and polio. Concerns about the safety and efficacy of a new vaccine developed in record time, rumors put forth by anti-vax groups, and the dissemination of information not based on scientific evidence, and also the political polarization, all have the potential to create barriers to vaccine uptake when the vaccine is available. As members of the media and communicators, we do believe that you need to play a very important role in dispelling any myths and falsehoods surrounding the COVID-19 vaccine. And as such, protecting the health of your community is vital. We do believe that since the very beginning, PAHO has been working to communicate transparently what we know and what we do not know about COVID-19 in order to clarify misunderstandings and to debunk rumors. However, we cannot do this alone. We do believe that your participation will be very important. I have no doubt that the best way to overcome any kind of hoax, rumors that are disseminated is when we provide information based on scientific evidence that we have, and also when we are providing all the information in a very transparent way. People have concerns and we need to take them into account. We need to provide the information. We need to encourage the Ministry of Health to explain what they are doing, what are the steps that they are performing, also in a very transparent way. We can see for many information that the people sometimes they don't understand what are the steps that every vaccine has to perform before being released and before being recommended to be used. All the clinical trials, the regulatory aspects, the post-market surveillance. So there are many important aspects that we can contribute, we can provide information. The National Health Regulatory Authorities and the Ministry of Health also working together can provide all this information in order to have people receiving data and information and facts, not the opinions or rumors, and can make their own informed based decision. So we are counting on you also to support and to participate at this crucial time to help us get the scientific facts and evidence out to your respective audience. By doing so, you'll be saving lives. Thank you for your participation. I wish a very, very good webinar for all the participants. Thank you.
And Dr. Barbosa brings up some really good points, and one of the reasons for us doing this podcast is so that we get good information to people, information to help you make up your mind about what it is that you really need to do, and so that you have the best advice in front of you. Vaccines have been helping us curb certain diseases like polio, chickenpox, smallpox, and a whole host of different infectious diseases that can spread throughout a community within a matter of days, and sometimes maybe even faster. So the vaccines are important. They help protect us. They help us live better and help us to keep our society as a whole. And we need to understand the use of vaccines has helped us grow as a society and has actually done things to help eliminate infant death and needless deaths within our children. So there are some rumors that they need to be dispelled, and we also need to understand how vaccines are actually made and how they're tested to make sure that they are safe for our population to use. So if we listen to Dr. Lucia de Oliveira, she is an expert on vaccines and vaccine development, and let's listen to what she has to say about the process that every vaccine has to go through.
Sorry. Thank you, everyone, and thank you, Lisa. Could you please move? So, in the next 20 minutes, I'm going to present some general concepts about vaccines, how the vaccines work, vaccine development, what are the phases of clinical trials, the landscape of the COVID vaccine, and some aspects regarding vaccine hesitancy. Next. So, I'm going to talk in general about vaccines, but all the concepts that I'm going to talk here, they are applied to the COVID vaccine as well. So, vaccines prevent disease that can be dangerous or even deadly. They greatly reduce the risk of infection by working with body's natural defense to safely develop immunity to disease. In other words, vaccine is a part of a germ that is exposed to your immune system in a safe way so that it can learn how to fight off that harmful pathogen and protect your body from it in the future when this pathogen enter in your body. The World Health Organization says that that vaccines prevent, at least 10 million deaths worldwide between 2010 and 2015. Next, please. Quickly, I'm going to tell you how the vaccines work. So, vaccines help develop immunity by imitating an infection. So, the vaccine does the same thing that the virus or the bacteria would do if it entered in your organism. Once the imitation infection goes away, the body is left with a supply memory. And this memory will be activated when the germ, the virus or the bacteria, for example, enter in contact with your body. So that will remember how to fight with this disease in the future. Something important. Sometimes after getting a vaccine, the imitation infect can cause minor symptoms like fever, for example. So many people, when they get the shot, they say, I got the disease because I have some kind of fever or some kind of symptom. But it's not true. It is your body, this is working with this vaccine in order to prevent the disease. But this work that your body does is similar if it will do with the disease. So, and also it is important to mention that it takes a few weeks for the body to produce antibodies. And it means many times it's possible that a person infected with a disease just before or just after the vaccination could develop symptoms and get a disease because the vaccine has not had enough time to work. So this is another situation that sometimes occurs. The person gets the shot and gets the disease. And so it's possible that the vaccine didn't have time to do effect, so the disease will occur, or it was you get the disease before to take the vaccine. Next. Let's talk about vaccine development. Usually, this process is very large and complex, often lasting 10 to 15 years. And in this situation now that you are, and we are talking about this later, my colleague, Alba Maria, this vaccine will be produced, the COVID vaccine will be produced in much less time. It doesn't mean that the vaccine is not going to be secure and it's going to be safe. It's going to be safe and efficacious, because there are a lot of protocols in this moment, protocols from WHO, protocols from FDA, protocols from EMA, that are established rules and for this vaccine, which is going to be produced in a much shorter time, because this vaccine probably are going to, the vaccine or vaccines you are going to have in probably less than 2 years. I'd like to show you here something that everyone is talking about at this moment, about the platforms of the COVID vaccine candidates. So the COVID vaccines are using platforms that were used in the past, like virus vaccines or protein-based vaccines, but also are using novel platforms, which are the viral vector vaccines and DNA and RNA. The viral vector vaccine, for example, there is just one vaccine that uses this platform, which is the Ebola vaccine. And for the DNA and RNA, none of vaccine at this moment has been producing using this kind of platforms. So you can see that for this COVID vaccine, we have a lot of different platforms, including the old platforms and novel platforms. The next. Also, it has been in the media, and everyone talk about the phases of the trials of the vaccine. Before a vaccine to be licensed, we have 3 phases during the clinical trial. We have the preclinical trial, and during the clinical trial, we have 3 phases, phase 1, 2, and 3. The phase 1 is a very small scale number of people that we have. It usually is like 20, 30 people. And in this phase, it's tested on safety, doses, and efficacy of the vaccine. If everything is okay, we are going to go to the phase 2, where you are going to have more people in this clinical trial, usually hundreds of people, 100, 200, and we are continue testing for safety and efficacy of the vaccine. In the phase 3, which many vaccines are right now, COVID vaccines, is a large-scale trial, and tests expanded to thousands of people, with some receiving a placebo to test for safety, doses, and efficacy, as well side effects. So during the phase 3, we have people who received the vaccine and people who received the placebo. And at the end of phase 3, you are going to compare what happened with the people who received the vaccine and what happened with the people who received the placebo. With this comparison, we can analyze the data and verify what is the efficacy of the vaccine, for example, and also if the vaccine is safe or not. After phase 3, when everything is okay, the numbers are with the way that you are expecting, the vaccine has to be approved. So the regulatory agencies in the countries will approve the vaccine based on results of the trials. In some cases, as I mentioned before, for the case of the COVID vaccine, countries may authorize emergency use before trials are complete. Next, please. So everything is okay until phase 3. The vaccine was approved by regulatory agencies and WHO pre-qualification, for example, or used for emergency. And then we are going to go to the phase 4. And phase 4 is the phase that you use the vaccine in the real world. So if everything was okay in the phase 3, this vaccine will be distributed to the immunization programs in the countries, but we are going to continue during this time, which is the phase 4, monitoring safety, and also you are going to see how the vaccine works. And then we are going to do the studies about impact and effectiveness of the vaccines. Next, please. The landscape of COVID vaccine, October 15th. This graphic changed all the time. Usually, this graphic is from the numbers are from the WHO web page, and probably today they are updating because they update once a week. So on October 15th, we had 198 candidate vaccines. In preclinical evaluation, 156, phase 1, 25, phase 1 to 19, phase 3, 10, and none of them approved. So this is the state of the COVID vaccines at this moment. We don't know which them of these 10 vaccines in phase 3, if they are at work according to expected or not. But this is the situation right now. The next, please. Let's talk about vaccine hesitancy. First of all, I'm going to give you the concept. What is vaccine hesitancy? Is the delay in acceptance or refusal of vaccines despite availability of vaccine services. Vaccines hesitancy is another process, very complex with context specific, invariant across time, place, and vaccines. So sometimes we have problems with one vaccine, sometimes we have problems with another vaccine, sometimes we have problems in one country or in one region, and then you are going to have problems in another country, another region. And it is influenced by factors like complacency, convenience, and confidence. So we have to improve vaccination demand in order to address hesitancy. So addressing low vaccination requires an adequate understanding of the determinants of the problem. We have to know in each country about which vaccine and when, what is the problem and what is the situation that is generating this kind of hesitancy towards a vaccine. Next, please. So, in order to avoid, in order to handle the problem of the hesitancy in vaccines, we really need your help. Your job is critical to maintaining vaccine confidence in our population. As Dr. Jarbas mentioned in his speech, your job and to have you working with us really, really makes the complete difference. Next, please. I'm going to talk about some of the myths. I'm not going to talk about all of them because there are a lot, but I'm going to give some examples. For example, we don't need to vaccinate against rare disease. Why people say this? They say this because they haven't seen the disease in the last years. And why they haven't seen the disease the last years? Because all the children are vaccinated, so we don't have the disease anymore. But if you stop vaccinating, you are going to start to get the same disease again. Like, for example, measles, diphtheria, whooping cough. Another one, mercury makes vaccine risk. This is not true. There are a lot of studies that have shown that mercury is not a problem in the vaccines because the quantity is very, very, very small. And mercury has been used as preserving agent in some vaccines since 1930s. According to CDC, no harmful effects have been reported from the use of mercury in vaccines. Next. Vaccines cause autism. This is one very, very, very famous. Everyone was talking about this one. Unfortunately, this myth, which was from decades ago, was based in one study, just one study, which was found to have been fraudulent, and the head research was paid to make the connection between autism and the vaccine. After that, many other research have been doing, and all of them didn't show any link between vaccines and autism. Next. So now I'm going to talk about just three myths of vaccines. All of them are in our webpage. You have the link here. And in our webpage, Debunking Immunization Myth, you have many myths about different vaccines. Some examples. Will giving a child more than one vaccine at a time overload their immune system? No. The scientific evidence shows that giving children several vaccines at the same time has no adverse effect on their immune system. And also, there are many key advantages. For example, the children don't need to go to the health care many times because he or she is gonna take the vaccine, many vaccines in once time. Fewer injections, which is very good too for the child. So this is actually very good for the children, and not the opposite. Does the HPV vaccine make you infertile? No. Although this myth has received a lot of attention in the media, the Global Advisory Committee on Vaccine Safety from WHO has conducted an extensive systematic review about all evidence available and conclude there is no relationship between HPV vaccination and infertility. Actually, about the HPV, there are a lot of myths, and so I invite you to go to our webpage and see all of the myths and all of their answers to this myth. Is flu like a cold? Seasonal influenza is characterized by initial symptoms with high fever, cough, chills, muscle and joint pain, but could require hospitalization and many times can even cause death. And cold is caused due to other virus, and the symptoms are much lighter. Next. So here you can see all the reference that I used for this presentation, and you can have more information. And of course, I'm completely available for questions that you have after the presentations. Thank you for your attention, and don't forget, we need your help. Thank you so much.
Okay, so we listened to Dr. Oliveira speak about each of the myths that may be slowing people down or holding people away from actually go ahead and getting vaccinated. Some of the big ones is, again, mercury, and the other one is that vaccinations can give children autism. And as she said, that those myths were dispelled a long time ago, and the autism one was unfortunately done by false research, and we need to work to dispel this myth so that we can actually go ahead and get our children vaccinated and help slow the spread of infectious disease globally around the world. I want to thank everybody for listening to us today. Again, this is Policy and Rights here on Depictions Media Radio, and I am Michael. For those of you listening to this podcast, please do, wherever you may see it, find and click on that subscribe button so that we can deliver you the best we can in coverage and the latest updates on what is going on. Keep in mind, it is a free subscription. It won't cost you anything, and we do not spam. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.